Hello everyone, I'm Ish. I'm the CEO of Bite Dental Center, also the unofficial IT guy, part-time errand runner, and proud husband of Dr. Ishi Raman. I married into dentistry when we started our family many years ago. From her dental school days to running multiple practices, I've been behind the scenes from the very beginning. But my connection to Bite isn't just professional, it's deeply personal too. When I was 8, I lost my 2 front teeth in an accident. For years, I managed without permanent replacements. Life, work, finances got in the way. You know how it is. By the time I was ready to address it, the space had collapsed so much that there was barely a tooth and a half worth of space. So I needed nearly 3 years of adult orthodontics just to get that space, just to regain that space. And we approached it with expansion orthodontics. What I didn't expect through that treatment was how much the expansion would improve my sleep. I'd been living with undiagnosed sleep apnea, struggling every night without even realizing it. And once my tongue had room, I finally felt rested, and in a way it was eye-opening, quite literally. But that wasn't the end. I also needed treatment for TMD. Big word, right? Temporomandibular Joint Disorder. I have to slow myself down every time I try to, say the long version of TMD. My jaw was misaligned and I was clenching constantly, and migraines had become, part of my routine. I always carried Excedrin in that life. Wherever I was, there was some Excedrin around me, in my pocket, in my bag, wherever it might be. I ran on coffee in the morning and I hit a wall in the afternoon. It was like living with a limp. You just get used to it until you don't have to anymore. So we started with the TENS unit to relax my jaw and to relax my muscles and to deprogram my jaw. From there, Ishi, Dr. Raman, she found my bite, the true balanced neuromuscular bite. She made me a removable orthotic at that position, and within days the pain was gone. I didn't realize how much tension I'd been carrying until it was lifted. But like many of you, I live a busy life. As a consultant, it wasn't practical for me to wear a removable orthotic for 20 plus hours a day. So we then transitioned to phase 2 of treatment, which is a fixed orthotic. It's bonded in place. It opens my bite without needing something that needs to be taken out every night to clean, to eat, right? So I can now eat and work and live my life pain-free without having to, have something removable. The only adjustment of note that I had to make is that I now use water flosser since I can't thread floss between my teeth. But honestly, it's a very small price to pay for the benefits that I got. Now, one unexpected benefit of this treatment, right? When you go for TMD treatment, it's not something you expect to hear, but I've been told that I do look younger since going through that treatment. How so? So through years of clenching, I had collapsed my bite, and it made my face appear shorter and more sunken, and my smile line had reversed. All of these, are signs of aging. But with my orthotic in place, my face is now more proportional, my bite is restored, and I smile a lot more. It's because I feel better. It's a very simple reason, right? You feel better, you smile. The veil of pain is lifted, so I smile all the time. So some of my friends called it a dental facelift. Made me blush, but I do think they're right. It was very interesting an experience. It was very unexpected. So what's next for me? Eventually, I'll transition to phase 3 of the treatment, which is permanent restorations, crowns and bridges. That will give me full function and aesthetics in a completely non-surgical way. And as we open our doors to Bite, and as we open this house to all of you and welcome all of you for the help that we are here to offer, I did want to share my journey, because I know there are so many people out there living with chronic jaw pain and sleep issues and facial discomfort. And like me, you've probably just learned to live with it. But it doesn't have to be that way. There are answers, and we are here to help you find them. Welcome to Bite Dental Center. Thank you.